Good morning, everyone. Hello, hello. It's great to have you here with us today. We hope that you're enjoying your summer and taking advantage of the few last weeks of summer. We're super excited to have you all here with us today. So welcome to our August meeting and the webinar for Advancing Equitable Medicaid Reimbursement for doulas in New York. Next slide, please. So I am going to quickly, we have a lot planned for you. He's put in a lot in this meeting. We have a lot of content for this meeting, I'm sorry. So I'm just gonna really quickly go over some housekeeping items so that we can get started. So we are going to get started with some Zoom features, which I'm sure you're all pretty used to, but just in case, we'll go over them again really quickly. We ask that you please update your name. So update your preferred name and pronouns and organizations by opening the participant panel, hovering your name and clicking rename. We also will have a few polls during today's meeting. We will launch the poll at the end of the meeting that will pop up on your screen. You can complete the poll by selecting your answer and clicking submit. And we will also have, I think, 15 to 20 minutes, hopefully, of Q&A session at the end. So we invite you to participate by sharing your thoughts or resources in the chat and also submitting any questions using the Q&A function. At the bottom of your screen in the ribbon, you can set the microphone, which will allow you to come off your mute if you want to ask any questions during the Q&A section. You also have the camera icon, which will allow you to come on camera if you choose to do so. We'd love to see faces. So you can click on that if you want to come off screen. Again, you can open the participant panel to rename yourself. The Q&A icon, you can ask that to ask any questions, and we will have folks managing some of the Q&A. So some questions might be answered. If it's a really quick answer, we'll be able to answer that right away. We have the chat function also, so we invite you to participate and exchange with one another. The raise function that you can use during the Q&A section of this meeting if you want to ask any questions and come off mute. You can turn off the closed captioning if you need to do so. And again, the end button, we can use that at the end of the meeting when we're ready and when we're done and ready to leave the meeting. Okay, thank you. Next slide. So this is what we have prepared for you today. We're going to do really brief introductions and go over our community agreements. I know some folks are already putting on the chat where they're from and introducing themselves and the organizations that they work for. So if you haven't done so already, I encourage you to do that as well. We'd love to know who's on and who's joining us today. We'll very quickly go over an overview of NYCDA, which stands for the New York Coalition for Doula Access. We have so many of you today. I know that for the members, they know very well who we are and what we do, but specifically for those who are joining us for the first time, we wanted to just kind of really give introduction of who we are and what we do. We'll also briefly go over Medicaid reimbursement for doulas in New York, just a summary of what has been happening and where we are today. And then the bulk of the meeting will be spent on the alignment project overview and questions and closings at the end. So I'm just going to start again by introducing myself, and then I'll pass it to my co-presenters today. My name is Patricia Bernard. I am a doula advisor at the New York City Department of Health and Mental Hygiene, and it's a pleasure to be here with you all today. I'll pass it on to Marek.
Hi, I'm Marek. The funny accent that you're hearing is an Australian accent. But I have been here in New York City for roughly 25 years now, and I am what's called a collaborations architect, and I will explain what that means as we go through the presentation.
Michelle, I'll pass it on to you.
Hi, I'm Michelle Zambrano. I am the Director of Program for Health Leads New York, overseeing the New York Maternal Health Initiative and helping to co-lead NYCDA. Excited to be with you all today.
Great, thank you so much. We can go to the next slide. Here we have our community agreements, which we go over at every single meeting. So I'm going to read them over and I'm going to give folks the opportunity to uphold any of them if they feel inclined to do so. Okay. So our community agreements are as follows: be present, be accountable, be brave, be inclusive, take space, make space, address racially biased systems and norms, and be open to anti-racist dialogue. Is there anyone who feels like upholding any of them or speaking to any of them? I don't see anything in the chat, so I'll take that as a no, and we can go on to the next slide. Great. So who are we? As I mentioned before, we are the NYCDA, the New York Coalition for Doula Access. And we're a diverse member-driven association of doulas and supportive allies who provide an array of prenatal birth, and postpartum services. We currently have over 150 active members in the coalition, and we are continuously recruiting members. So if you're interested in New York, and if you're interested in joining, please let us know, put that information in the chat. The sponsor, the New York City Department of Health, is the project sponsor and the coalition co-lead for this project. And we have dedicated staff as well as funding for this specific project. And then our partners, Health Leads, they're a national nonprofit organization, and the New York team serves as the backbone organization for this coalition. Next slide, please. Next slide, please. Oh, sorry, I didn't see that changing. So what is our vision? Our vision is to ensure that doulas have a powerful voice in determining their own professional standards. And our efforts focus on increasing access to doula care in underserved communities and improving the integration of doulas as valued members of the care team. We believe that these efforts will help address and reduce racial inequities in maternal health outcomes in New York. Next slide, please. And our two main goals, the two main goals that NYCDA is focusing on now, is the first one is to set standards for a living wage for doulas through Medicaid reimbursement, and we'll talk more about this for the remainder of this meeting. And our second goal is to develop a doula-friendly hospital designation. So with that, I'll pass it over to Michelle.
Great, thanks, Patricia. So I'm going to briefly review some of NYCDA's key milestones here, and we'll also be happy to share some of the documents and resources that are mentioned with you all when we share the meeting recording. So I know some folks might be interested in that. So NYCDA was first convened back in 2011 by Mary Powell Thomas, who is the current director of the Citywide Doula Initiative and Healthy Start Brooklyn, and is a current member of our NYCDA core team as well. And during this time, the Medicaid redesign team was looking for ways to improve care and reduce costs. So of course, the recommendation of the coalition was that doulas be covered by Medicaid. But unfortunately, the Medicaid redesign team did not include it in their list of recommendations at that time. So I just want to take a moment to recognize the efforts of many of the folks within NYCDA who have been fighting for this issue for over a decade now, and acknowledge the expertise that's held within our coalition by members who are still here advocating for an equitable Medicaid reimbursement structure. And we've also been incredibly lucky to have many new members join us in these efforts, and to also learn from the implementation of Medicaid reimbursement in other states. NYCDA has successfully increased access to doulas for underserved populations over the years by helping to design programs such as Healthy Women, Healthy Futures, which was the precursor to the Citywide Doula Initiative, which connects community-based doulas to support clients who are experiencing stress from social, racial, and economic inequities. NYCDA members also created the Principles of Doula Support in the Hospital, which became the foundation for the doula-friendly hospital model that has been successfully implemented as part of the Maternity Hospital Quality Improvement Network. NYCDA has always advocated on behalf of doulas, and now with the increased recognition of the role doulas can have in improving inequities in maternal health outcomes, and the desire to increase access to doulas, especially for Black women and birthing people, it is more important than ever that doulas help set the standards for their profession. And we have now re-engaged the coalition once again around the issue of Medicaid reimbursement. So next slide, please. So simply put, doulas deserve a living wage. Doulas are caregivers, and we all know that caregivers are critical to addressing essential needs, accessing health and mental health care, improving community conditions, and enabling racial health equity. Doulas offer support during the prenatal, birth, and postpartum periods and provide resources, education, and empower their clients to advocate for themselves and their families. We believe that increasing access to doulas is one way to help improve maternal health inequities for Black women and birthing people, and that doulas deserve a living wage for the services they provide and the vital role they play in improving these outcomes. Next slide, please. So now I'll get into a little bit of why we invited you all here today. So over the last 5 months, we have reconvened NYCDA, and in April, members agreed to the priority focus areas that were mentioned. And in May, we discussed the current state of doula reimbursement in both New York and across the country. And members started to outline what their ideal Medicaid reimbursement structure might look like. And in June, we presented the opportunity to partner with Alchemy Insights on this work, and members agreed to move forward with the project. And just last month, we identified key stakeholders who should participate in the project. And that's why we've asked you here today for our project launch. So I'm going to hand it over to Marek now so he can give you a detailed overview of the project and share exactly how you can participate.
Thank you, Michelle. So as I mentioned before, I'm a collaborations architect. So what that means is that I take groups of people saying that, individually saying we each think this, and taking the group to say we all agree to do this in this way. And I rely on a technique that's based on Nobel Prize winning thinking to be able to bring this about. Now, in our case, what we're wanting to unite around is the equitable reimbursement structure for doulas in New York State, the support structures that go into that, the processes and the governance, etc., that will be needed to maintain it. So that's what we all want to be able to unite around. And we'll be doing that by engaging everyone in the system. And if we can go to the next slide. So instead of a group of well-intentioned, well-informed, qualified people meeting in a room to discuss this strategy, we figured that it would be more powerful and more convincing and more actionable if we were to engage everyone and do this from the ground up. So what we are doing is we are inviting all of the doulas in New York State, all of the doula associations, people from the hospitals, maternal health organizations, the Medicaid payers, people on the payer side, which is really important, academia, people from New York State Department of Health, and even past patients, and getting them to all contribute to their opinions and express these ideas on what equitable reimbursement looks like and those supporting structures that go into maintaining it. Now, people will say this is an incredibly ambitious undertaking, and it is, because we actually want to do this by Thanksgiving. So what I wanted to do now is to take you through the disciplined, methodical process, how we will be able to bring this about. So if we can go to the next slide. So the technique that I use is based on some Nobel Prize winning thinking. In 2005, Thomas Schelling and a group of others won the Nobel Prize for Behavioral Economics for their work around like-mindedness. So he posed the question, or he posed the statement that if you ask 1,000 people to meet somewhere in New York City, and that's all the information that you will give them, the overwhelming majority will choose the clock at Grand Central as the place to meet. So this is called a Schelling point. And the technique and the methodology and the software that I use is actually called Schelling point, based on this thinking. So Schelling constructed the mathematics and the science that goes around that enables people to reach this common point. So how does a Chinatown in a community emerge? What's the critical mass that's required for that? How does a flower district emerge in a town, in a city? So, you know, the science around that is what's going to be underpinning this whole process, and what's going to enable us to be able to work together and come together to agree on what equitable reimbursement should look like. So I just want you to keep this picture in your mind as we move through the next slides. So if we can go to the next slide, let's go into it a little bit more detail. If we were to ask everyone in the ecosystem what equitable reimbursement looks like, everybody would have their own point of view. Everybody would come at it from their own perspective, based on their own experience and their own best intentions. This is a completely natural phenomenon. It also means that it's very messy, because even with a small group of people, you would understand like the difficulty in getting people to see what that common point of view is. And especially then if we expand it out to, you know, the hundreds of people in New York State that we're talking about, if we were to do this, if we were to undertake this process in traditional ways, it would take us many months, maybe even years, to be able to accomplish it. But using these techniques and the technology behind it, if we can go to the next slide, what we'll be able to do is we'll be able to resolve all of these indifferences. So in that previous slide, I talk about that messiness, and the way that we describe it is that we have different dictionary, data, and drivers. And the methodology that we're going to be using will eliminate all of those ambiguities that surround that. So that we'll use the techniques of the thinking of Thomas Schelling. We'll introduce some thinking from Harvard Business School, pioneered by Professor Chris Argyris, about how people work within organizations, and also some thinking from Wharton Business School from outside in thinking, and throw into that some work around relational networks, and we'll be able to effectively get everybody to a common place by Thanksgiving. So I'd like to now step in through the details of how we're going to do that and what the part that you will play in it. If we could go to the next slide. So what I've demonstrated here is what we call a strategic collaboration. Now, this is a highly simplified version of a strategic collaboration. There are actually many more points in here, but for the purposes of our meeting today and our time constraints, I've simplified it into these three basic sections. In phase one, Michelle has already explained that we've actually scoped out this project. We've decided on who would need to participate to present all of the different points of view that are necessary. And the other important aspect is that we've started to assemble the advisory team. And if we can go to the next slide. So this is who we have on the advisory team so far. So the advisory team's responsibility will be to guide my work and the core team to make sure that it is reflecting accurately the views of the whole community. So these people here will be speaking for the rest of the group and advising this project on how it moves forward so that it is accurate and complete. there are a couple of people that are missing from this advisory team, and we were wondering if we could ask your help in recruiting these people. We need somebody from the New York State Department of Health to join this team to offer their perspective, and also somebody from the payer side. So if you are somebody who is on this call that would like to join the advisory team, please reach out to Michelle, or offer your name in the chat, or if you can think of somebody that you would like to nominate somebody, do the same. Reach out to Michelle and or put it in the chat. So if we go to the next slide, so the tasks of the advisory team would be that they would spend about 15 hours over a series of meetings to guide and resolve both the agreements and the differences that we have, and create endorsed coordinated actions at the end of the project. So the people who would be participating on this team will be compensated for about 15 hours, mainly during the month of October, and will be asked to engage in a series of meetings. So we could go back to the, anything else I need to add here, Michelle? About the advisory team?
I think you've got everything. You mentioned the payer side and the New York State Department of Health are kind of the gaps right now that we have on our advisory team. I'm seeing we have some help from folks in the chat in terms of connections to the folks at DOH. And if we have any connections to payers as well, we welcome that.
Thank you so much. So the next part of the process is what we're about to engage in now. And this is the reason why I wanted to talk to you today. So phase 2 is what we call the gathering of the opinions phase. So if we can go to the next slide. Sorry, yeah, that's it. So imagine if we were in a large room. Everybody is expressing their opinions about equitable reimbursement. We would find our like-minded groups. Everybody would assemble in those like-minded groups, and then those groups would then form alliances with other groups. Eventually, at the end of the day, we would form some kind of consensus around what equitable reimbursement looks like. This is what we're going to be doing, but we're going to be automating the process. We're going to be automating the process, and we're going to be throwing a bit of rocket fuel in there as well, just to speed it up, okay? And this is the way that we're going to be able to accomplish all of this by Thanksgiving. So the first part of the process is that we're going to ask you for your opinions about equitable reimbursement in the form of some open-ended comments. So if we can go to the section for the open-ended comments. So for those of you that the poll has just popped up here to ask you if you wanted to participate in this exercise. Okay, so what we're asking you is to say either yes or no, whether you wanted to participate in this part of the exercise, because the opinions that we're going to be sharing with the rest of the group later actually need to come from the group themselves. They're not going to be created by me or any a small group of people. They're going to be coming from the group as a whole. So you will be deciding what it is that you will need to be discussing and that what you would need to be talking about. So in other words, you will be setting the agenda. So the way this happens is that I will send you a link with a video, an instructional video on how to fill out this section. And imagine that you're being interviewed on television about your views around equitable reimbursement. And the host is going to be asking you a series of questions. They will have some questions and some prompts in front of them, and you're going to be telling them what you think. And imagine that is exactly this exercise. You'll get a link to an online form that looks like this, that will have a series of prompts or questions. And all we ask you to do is to type in your responses in the box below. We'd ask you to use one sentence at a time, if you can, and to use full sentences with details. It just makes the job easier for us. There will be 4 sections here. There will be sections pertaining to goals, like what success looks like. There will be another section about unintended consequences. There will be another section about barriers, and there'll be another section about assumptions. We would estimate that this process will take approximately 1 hour for you to complete. So please, if you are interested in doing this, we would love to get your input, because it's required for us to then structure the opinions that are going to be shared with the rest of the group at a later stage. And we may as well talk about what that looks like now. If we can go to the next slide. So the next part of it is that I take all of these statements and I convert all of these open-ended comments, and I convert them into single declarative statements, which are then put on an opinion survey. I then code each one of these statements and classify them according to, like, the mathematics and the frames that we have that drive this system. And everybody who is participating in this project will be invited then to participate in that opinion survey, even the people that have expressed their open-ended thoughts. Okay, so this is what it would look like. So you will get an email from me with a link to this online survey, and there will be a short video explaining to you what you need to do. And all it is, you know, you guys know what a survey looks like. You just click the buttons. This is a screen grab of one that I did before. You would just click the buttons to the extent that you agree or disagree with each statement. And again, you would go through these 4 sections: the goals, unintended consequences, barriers, and assumptions. We're figuring there might be about 100 or so of these statements. It should take you half an hour or so to complete, but you should set aside 1 hour. Now, at this stage, if we can go back to the previous slide, at this stage, one thing I forgot to ask you to do before I began this process, began this section, is that could you all please open your diaries or calendars? So if you could do that, if you have elected to participate in the open-ended dialogue, can you please set aside 1 hour during the week of August 26th to September 2nd to complete that? Please put that in your diary now. Now, for everybody else who is going to be participating in this, could you set aside 1 hour between September the 12th and September the 16th to complete the opinion survey, the online opinion survey? It won't take you an hour, but if you could set aside that 1 hour, that would be great. It's just going to save a lot of time in us trying to follow you up to make sure that you complete the process. If we do this now, and if we lock it in, it's just going to enable us to do this whole thing in a timely way. So we've done the opinion survey. The opinion survey has been created in the open-ended statements that people have submitted in the step before that. So the opinion survey comes back. There might be some opinions that you have expressed that are out of step with the rest of the group. We will send those questions back to you and say, listen, Michelle, everybody else responded in this particular way, or generally responded in this particular way, but you decided to respond in this way. Do you want to change your mind, or is there any reasoning that you want to give us as to why you want to stick with your opinion? And again, that reasoning is going to be important for us as we move through the process. So again, if you could put in your diaries 30 minutes between September 26th and September 30th to complete this, what we call convergence phase. So those 3 steps encompass what that virtual dialogue looks like. That large imaginary room where we're all gathered together and we're exchanging our points of view. So if we can go back to the process slide. What happens then is buttons are pressed, calculations are made, and all sorts of analytics are generated, and I then present a report to the advisory team. That report will tell us how close our heads are together, where the alignment is happening, where it isn't happening, why it isn't happening, and what we actually need to do about it. So this gives us, excuse me, this gives us an accurate picture of that ink blot that we saw before. What we now need to do is take that ink blot and turn it into an apple. And this is again where the advisory team will come into play. Over a series of meetings during the month of October, we will take these analytics and those comments that you have provided in your reasoning forms, and we will turn all of the agreements into we will look at the agreements and using various tools and artifacts, group those agreements, but also the areas where we're not agreed on. The group will use various tools and techniques to be able to turn those misalignments, if you like, into alignments. And once we do that, we can then create these coordinated actions or these recommendations by the end of Thanksgiving, which we will then be able to work on and provide the irrefutable evidence to legislators in the new year as to what equitable reimbursement should look like. So that is the outline of this strategic collaboration and your involvement in it. And again, I just wanted to say that I'm really excited and honored to be a part of this project and to help you to be able to achieve this. And I hope that you are as excited as I am that we'll finally be able to get somewhere with this. So with that, back to you, Michelle, and you can do the wrap up and open it up to questions.
Thanks, Marek. So there's been a lot of questions coming in through the Q&A and also through the chat. And I do want to, I think we've answered a few as we were able to, but I do want to address a couple of the comments. And Brian, I see one from you in terms of, can you speak more about who and how many people will be recruited in opinion surveys outside of this Zoom? So obviously, we have about 150 folks on the line. I think we had a couple of hundred people who registered for this meeting. And of course, we will continue recruiting folks even outside of this call who didn't attend. And that's why we will have the recording of this and be able to share the information with anyone who is interested in participating. And then how will the sample of participants reflect the stakeholders, i.e. doulas who identify as Black, Brown, Indigenous, and other essential voices, and what is the target number? So for the target number, we're unsure of how many doulas are practicing in New York. I don't think there's a definitive number, but if we could have every doula who practices in the state of New York respond to the opinion survey, that would be our ideal state. We are doing really targeted outreach in terms of the priority communities and community-based doulas, Black doula associations, Black-led maternal health organizations. We have been really conscious in our efforts as well as during our NYCDA recruitment in those areas. So we feel that the coalition and folks that we are connected with beyond the coalition will amply reflect the participants and the stakeholders. But we welcome, any connections that folks on the line have, any gaps that we may have in, as this is a statewide initiative and we're doing a lot of this work virtually. If you have connections on the ground, we would love for you to share that with us. And Marek, did you have anything in terms of the target number or anything that you wanted to add?
No, I just think it's important that we do get points of view from the payer side and like the hospital systems, because, you know, we need to address like relationships between doulas and people who, and medical workers. So we're just approaching this in a real world situation, you know, so it's not just the doula's point of view, it's in the doula's point of view with the perspective of the realities of the marketplace and the business as a whole.
And then there were questions about if you had to be in New York State to participate in the interviews, which I believe is not necessary because there are some folks, we have folks even in our coalition who have done extensive work in Medicaid reimbursement in other states and have a great perspective to bring. And so if my understanding, Marek, you can correct me, is if you have an opinion or thoughts around what Medicaid reimbursement should look like, you can participate.
Yes, that's correct. You can participate. What we will do is, look, at the end of the day, this is a project for New York State doulas, okay? When it comes time for us to be converting those statements that you have provided us into the opinion statements, we'll make sure that they're reflecting the situation of New York State.
And when we say payer, we mean specifically insurance reimbursement or individuals who are procuring doula services. So we're in this, Jessica, in this case, we are talking about insurance, Medicaid managed plan, and providers of that nature. And I just want to clarify for our members, so we do have a Medicaid subcommittee that we are starting to form within our NYCDA coalition. I just do want to clarify with the project advisory team, because I also saw in the chat, there are a lot of folks who are interested in joining the advisory team. I know that's a smaller group, a subset of participants that's meant to be a representation of the different stakeholder groups. And so we do have community-based doulas who were recommended by our coalition to participate and practicing doulas as part of our advisory team. And Patricia, I don't know if you wanted to say anything more to that. I saw you come off mute.
No. I just wanted to, I think there's a question that was asked about information asymmetry from Marek. So I just wanted to read that out loud. That's all.
Oh, okay. So in terms of just to clarify, the project advisory team is going to be both folks from the coalition and outside of the coalition who are going to be doing the work that Marek described, that kind of very specific time commitment of the 15 hours throughout the course of the project. Our Medicaid reimbursement subcommittee is folks who are joining that are committing for a year to kind of, and they are coalition members who have, who will also be informed and updated about this project, but the kind of extension of that group is going to go beyond the term of this project specifically. So that's kind of the difference between the reimbursement subcommittee that our NYCDA coalition is forming and the project advisory team. So there was a question from Marek that you wanted to.
Yeah, there's someone who asked, how do you address information asymmetry around alignment in your addresses? i.e. not everyone has the same information, education on reimbursement payment models.
Yes, it's the way that we classify and group the different participants. So we will know where the alignment is coming from between the say it's people from upstate New York versus downstate New York versus the payer side versus the doula side. So we'll be able to determine the level of alignment between those two groups. So it's the way that we've captured the information in the first place, or the necessary information about the different participants and where they might fit. Now, I have to specify that all of the information that you provide us will be anonymous. Okay, I forgot to mention that before, and that's really important. All of the information that you provide will be anonymous. It's just the data that's going to be shared. Okay, so the way that we arrive at the alignment is it's that mathematics that's from Thomas Schelling mainly, is the way that we're able to calculate that alignment. We're able to calculate the degree of the alignment and the and also the passion and the sentiment behind that alignment. So I'm hoping that that answers the question. If it's not, please keep going, and I can provide more clarity.
And I can see that Luz Montanez has their hand raised, so I'm going to allow you to unmute and ask your question. Oops, I just went away. Never mind, guess not. We have another question from Pranali. I will allow you to talk.
Thank you for answering that question. And I don't know if I made a typo in it, so I just wanted to clarify. If you want to have an opinion on reimbursement and you know enough to have some sort of opinion, but you want to be educated enough, and the information asymmetry comes from, maybe from my perspective, I have an idea, but I don't know everything there is to know about reimbursement to maybe have a totally informed opinion. And so how do you address the fact that everyone comes with their own information about reimbursement, and maybe not there's not a level playing field across the board? So when people have their answers or have their opinions, how do you know they're coming from like a similar, I guess, information level?
They're coming from the similar information level only from the fact that it's their own point of view. Okay, we don't want you to express your opinions that you think are for everyone else. They have to be your opinion. Okay, so we're asking you, like, what do you think? We may ask you questions, what do you think your colleagues might think, or what do you think that others might think, but it is still your opinion about that. And then, that it's as simple as that. It's as simple as that. The behind the scenes, like the mathematics and the way that we process, the way that we've classified that information, the way that we've coded all of those opinions, then enable us to be able to draw these conclusions from it in the analytics. So it's just important that you express the opinion from like your own point of view. It doesn't matter whether you're educated or not, or whether if you don't know anything about this subject matter, you can just not provide an opinion.
So basically, yeah, everyone doesn't need the same baseline understanding of, or like, we're not looking for all like folks who are participating in this project to have like a deep knowledge or the same knowledge about Medicaid reimbursement. It is their opinion of what the Medicaid structure should look like. And to that point, Nairi had a question.
The diversity of opinions. Yeah.
Diversity.
It's important for us to capture that diversity of opinions, all of the different facets.
I wanted to call out Nairi's question. I agree that doulas deserve living wage for their services, but you don't want to pay them as much as you pay physicians, right? How much will you take this into consideration and balance this in the project? And I think that's something that come, like the actual amount of the reimbursement rate would come out in the opinions and interviews that are being completed. I will say other states are paying doulas a rate higher than physicians. Why? Because doulas can only see a limited number of clients a month and have greater time one-on-one with those clients. So physicians can see maybe 20 or 40 clients, patients a day, and bill for them. And so there's actually, when you're looking at an equitable reimbursement structure, all of these things and all of these points need to be taken into consideration. And that's what we're hoping to gather, from this process. And to Brian's question, in terms of anticipating if full spectrum doula reimbursement would be extended to abortion companionship, I don't know if that's something that we could answer right now. Again, if it, in terms of what is covered, that's what we're looking for in the opinion surveys and in the in this process. So we're looking at, is prenatal care covered? How many prenatal visits? How many postpartum visits? What else? What other kind of training and services that doulas provide might be covered under this Medicaid reimbursement structure? So certainly abortion companionship could be an option there. And somebody asked about the project advisory team having representation from hospital providers and systems. I think we can certainly, we have folks who are working within those systems, but if there's additional representation needed, I think we can take a look at that.
There was also a comment made about doula representation in the advisory board, advisory group for this project. So I think we can look at that as well.
Yes, we do have practicing doulas as members of the advisory team. And midwives, we welcome, Erica, we welcome the responses from midwives as well, if that's your question. And of course, we're looking for folks who have used doula services or would have liked to have had their doula services covered by Medicaid, yes. Effie, when will community hear the base fee for reimbursement? Could you want to give voice to that? I'm not sure exactly what you're asking if in terms of the actual amount of reimbursement. I don't know if you can come, I see your hand is raised. If you, Danielle, if you're able to unmute her.
I will, you can unmute now.
Hi, can you hear me?
Yes.
Hi, my name's Efe. I asked the question because there is a background history with the state and Medicaid and community doulas. I would say, I think it was 2017, 2018, where there were town halls, there were protests considering Medicaid reimbursement and certifying doulas, the state wanting us to be certified by the state versus community services working together. And I think at the time, we also had other projects like Healthy Women, Healthy Futures. Just that those pricings were below minimum wage, almost poverty rate for reimbursement. And today, with increasing, with inflation of gas and food, $3,500 is maybe like the average doula, birth doula right now, and that's still completely low the wage of a lot of doulas based on their experience. For instance, I'm a trained midwife and I also do doula work, right? Does that mean that I make the same amount of money that someone who took a 3-day training this summer, and that's just equal wage, right? And so the equitable wage is what I'm kind of, I don't know what the fee is and how do I even trust this process considering the history that we've had and how there's been very secrecy around the fee as well.
Yeah, I think you're referring to the state pilot that's currently underway in Erie County
Yes.
with the Department of Health, and the reimbursement rate is certainly lower than what we would consider an equitable Medicaid reimbursement rate. And so that's one of the reasons why the coalition is taking on this work and undertaking this project. We feel like there needs to be a statewide solution in terms of a reimbursement rate that at least matches what other community-based doulas might be making in their program serving a similar population. And so, you know, we've seen this in other states where the rate is low. Somebody, I think, just put this in the chat. Oregon had a reimbursement rate of like $300 and nobody participated, right? So you're not going to increase access to doulas if nobody's participating in the project and the rate is too low. So they are actually proposed to increase it to $1,500 now, which is a more equitable rate. And so, you know, we really want to get this right for New York. We want to, if we're going to propose a plan for statewide Medicaid reimbursement, we're undertaking this process and this project in this way to ensure that we don't have to go back and readjust reimbursement rates down the line, or it's, you know, we left out some critical form of care or thing that should be covered. And so, you know, we are hoping that the end result of this process is a really comprehensive proposal that constitutes an equitable Medicaid structure for the state, and that it will be, you know, well received by the folks who need to implement it.
Yeah, I'm totally looking forward. Yeah, that was really great. Thank you, Michelle. I look forward to seeing what more of that looks like. I think the thing that mostly gets left behind in talking about fees in New York is how much we pay for rent and how much we need to live. And so while there is a base fee of like $1,500, if my rent is $2,200, what does that mean? And overwork and the burnout of a doula is around 1.5 years. So, you know, yes, you can take more clients, but how long can you do this career if your fee is at $1,500 in a state where rent constantly keeps increasing? And so while I agree with the fee, I think there's also other things that the doulas, that community doulas in the city need to be also in considerate of our housing, of our own medical and health insurance, that we don't get health insurance reimbursement for ourselves and things of that nature. So, yes.
Good. Effie, could I just ask a question? Are you participating in the open-ended dialogue? Did you press yes in the poll that you'll provide the open-ended thoughts? Because we were really liking it. Okay, excellent.
Yes, I press yes.
The other thing that you mentioned a key word, and that is transparency. Okay, so the advisory team, when they work through the resolutions that they need to work through, all of the decisions or the recommendations that they come up with, they're going to be shared back to the rest of the group. So there's going to be nothing that's acted on or decided upon without input, without commentary from the rest of the group. The advisory team's job is to reflect accurately what the rest of the group wants, not just what they want.
Got it. That sounds great. Thank you so much. Looking forward to participating.
We have an additional question here, and it says, how would you keep answers anonymous when there are different entities represented, i.e. doulas versus payers versus policy?
Well, the groups are not going to be anonymous, but the individuals will be anonymous. There's going to be more than one person in those groups. We have an undertaking, and in fact, we share a non-disclosure agreement with everyone that all of the information that we're capturing is going to be anonymous. We won't share your name with anyone, ever.
Thank you. I hope that answers the question that was asked.
Is Pranali has her hand raised up the top? Oh, sorry.
That might have been from earlier. Or did you have another question, Pranali?
No, that was it. Thank you.
Okay, thanks. So I know there are a number of additional questions in the Q&A and lots of stuff coming through the chat. We are happy to follow up as I know we're coming close to our time together today. And I do want to just be able to close us out. We have a short poll for you all to take, and you can also, if there are comments, or if you have questions or comments that did not get addressed, there is a survey that should pop up for you to type in any additional questions or comments. So we appreciate you taking the time to fill that out. And then if you are planning to participate in the seed interviews with Merrick, the initial one-on-one interviews, he's going to be reaching out to schedule those. We have captured your information. We're going to reach out to the folks who expressed interest in participating in the project advisory team. We are looking forward to collaborating with all of you and asking for your assistance in kind of spreading the word about this project, getting other folks on board for the project. The evaluation survey should have just popped up now, and so we really look forward to this process. We have this condensed timeline. We're trying to keep everyone engaged and involved and build on the momentum that we have going, and so we're excited to see progress in this area after many long years in this fight. So thank you so much for those who joined today. Please reach out. Our contact information and everything is available if you have any additional questions, and we will be sending the slides, the recording, and additional resources by next week.
Michelle, do we have time for one last question?
Sure.
Okay, I think there's a question here that says, has there been expressed openness from the State Department of Health or legislators for this recommendation around Medicaid reimbursement?
Yeah, so we have some legislators in our coalition, and we are working with colleagues at DOH. We've informed them of the project, and we're hoping that they're able to participate as well. And for the folks who have connections and other folks within DOH and legislators who you might connect us with, then we are happy to set up time and speak with them about this project and to get them on board as well. Thank you everyone for joining. Thank you, Merrick and Patricia.
Thank you.
And for all the engagement. Thank you so much, everyone.